Hello everyone. You are watching sqadia.com and I am Dr. Madhadar. Today our topic is femoral shaft fractures. In this topic we'll be discussing different entities. First and foremost would be the isolated femoral shaft fractures. You know that as in case of RTA, the most commonly mechanism is associated polytrauma. With the shaft of femur, there may be associated head of femur fracture, neck of femur fracture. There may be ipsilateral tibial fracture as well. But what is the treatment and mechanisms and management of an isolated femoral shaft fracture we will be discussing in this lecture. Then we'll be going on to the open femur fractures. As you know, the femur fractures could be open or closed. And open femur fractures are problems because they may be associated with lot of bleeding. Patient may present with hypovolemic shock, and you need to first resuscitate the patient and then think of the fracture and fixation as well. Sometimes these open femur fractures may be 3B or 3C injuries, in which there may be massively open wound, a lot of periosteal stripping, contaminated tissue, and will require some form of graft or flap as well. In this kind of a situation, the first and foremost method is to go for external fixation and take care of the wound and soft tissue first, and later on fix the fracture with internal fixation. Or it may be a 3C injury in which the femoral artery may be transected, in which you need to first go for external fixation to stabilize the fracture, repair the artery, and once the soft tissue permits, then we can go for some form of internal fixation of the femur. We will be moving from that is to the complex injuries. Complex injuries means shaft of femur along with the acetabulum and pelvic injuries, or shaft of femur with vascular injuries. These all include the complex injuries. Then we'll be moving on to the pathological fractures. Although in children there is a rare form of injuries, but in adults, especially in the patients who had some form of CA, the patient may present with the pathological fracture, and it's you have to stabilize the pathological fracture along with the excision of the tumor as well. Then we will be going on to the periprostatic femoral fracture. Nowadays, total hip and total knee replacements is quite common, and patients usually have after total hip or total knee, they may suffer from some form of a trauma and eventually leading to periprostatic fractures. Now, once we will be done with mostly these injuries and shaft fractures in the adults, then we'll be moving on to the femoral shaft fractures in children. As you know, the femoral shaft fracture in children depend upon their age. If it's less than 6 months, then we have to go for Pavlik harness. From 6 months to 5 years, we will have to go for hip spica, and from 5 to 10 years, will require either a form of plating or flexible intramedullary nailing. And those children who are above almost 11 or 12 years and above that usually are treated like adults in form of intramedullary nail fixation for the femur fractures. Then we'll be discussing the supracondylar fractures in children as well as the adults, and why it is important, because this physeal injuries to the children can produce LLD and limb length discrepancy, which may be very high as 8 to 10 centimeters later on. So need to be careful when treating these distal femoral shaft fractures, especially in the case of children. Then we're moving on to the fracture separation of the distal femoral epiphysis, which also damages the physis and which may produce LLD or even the angulation at the knee in form of genovarum and genovalgum as well. So these injuries are critical because they are problematic not only for at the time of injury but also later on as well, because eventually these children may present with a lot of problems such as LLD, shortening of one limb, and one limb may be too long, and problems with hip and knee pain as well. If you want to view more lectures on orthopedics, there is a plethora of lectures available on the website. Go to sqadia.com and watch out more videos like this. Thank you very much. Keep watching sqadia.com.